According to the U.S. Department of Health and Human Services Office of the Inspector General, fraud, waste, and abuse cost taxpayers nearly $60 to $70 billion each year. A significant contribution to this comes from two main causes of healthcare fraud: upcoding and overbilling. Once detected, it can put the defaulter in serious troubles, including jail term. In the previous video, we reviewed how upcoding and overbilling happens. In this particular video, we will review the steps organizations must take to prevent upcoding and overbilling. Coding for higher item or service than were actually performed is considered illegal. For example, coding for an initial inpatient consultation with a higher level E&M code after performing a follow-up inpatient consultation is considered a fraud and should be avoided. Also, due care must be taken not to code for services that were not medically necessary for the patient. Another common misuse is billing separately for services already included in a global fee. Billing for an E&M service the day after surgery when the follow-up is already included in the global surgical fee is a no-no. Billing for services at such low quality that they are virtually worthless and billing for services that are not rendered should be avoided. Inappropriate use of modifier codes is a common mistake and must be avoided. Do not claim payment for an E&M service when care rendered was not significant, was not separately identifiable, and was not above and beyond the care usually associated with a procedure performed. Even after taking necessary safeguards, coding and billing mistakes do occur. Performing regular audits, both internal and external, is one of the best practices to address this. During the audit, reconcile the services rendered on the patient's chart with the services coded on the payment claim to make sure that they match in every case. How often these audits shall be performed depends on practice size, complexity, and approach to billing. However, having an external audit in every quarter is recommended. Let us take a quick look at what we have reviewed so far. Provider organizations must safeguard themselves from upcoding and overbilling by staying away from 1. Coding for higher reimbursements than were actually performed. 2. Billing separately for services already included in a global fee. 3. Code for services that are virtually worthless. 4. Code for services that were not medically necessary for the patient. 5. Inappropriate use of modifier codes to increase the bill amount. Hiring a medical coding and billing company that fits budget and size is one of the proven ways to address all these challenges in a comprehensive way. It covers the risk of internal staff committing errors and ensures that the process is carried out by professionals who are always up to date on their knowledge. Apart from protecting your business from these fraudulent practices, a suitable outsourcing partner will also help maximize your reimbursements by suitably guiding towards best practices. How is your medical billing benchmarked today as compared to industry best practices? Are you facing compliance challenges or leaving money on the table due to inefficient billing process? Call the professionals in Acusis at 855-422-8747 or email rcm@acusis.com for a comprehensive audit of your practice's needs. For more informative videos and staying up to date with the latest developments in RCM, visit www.acusis.com/RCM.